Head Start programs must annually train a governing body, policy council, management, and staff who determine eligibility on the regulations and program policies and procedures that guide the implementation of the ERSEA process. ERSEA stands for Eligibility, Recruitment, Selection, Enrollment, and Attendance. Our program serves the counties of Jackson and Hillsdale, including families within the school district boundaries served by those counties. Children are also eligible to attend if a parent works or attends school in Jackson or Hillsdale County. To design a program that meets community needs and builds on strengths and resources, a program must conduct a community assessment at least once over the 5-year grant period. The community assessment must use data that describes community strengths, needs, and resources and include, at a minimum, the number of eligible children and pregnant mothers, children experiencing homelessness in collaboration with McKinney-Vento local education agency liaisons, children in foster care, and children with disabilities. The education, health, nutrition, and social service needs of eligible children and their families, including prevalent social or economic factors that impact their well-being, are also addressed, including the typical work, school, and training schedules of parents with eligible children, other child development, child care centers, and family child care programs that serve eligible children, and the approximate number of eligible children served, resources that are available in the community to address the needs of eligible children and their families, and strengths of the community. Information is annually reviewed to update the community assessment to reflect any significant changes and adjust programming accordingly to address shifts. Staff must conduct an in-person interview with each family. If transportation is a barrier, a home visit will be completed. Early Head Start serves pregnant women or children younger than 3 years of age. For Head Start, a child must turn age 3 or 4 on or before December 1st. Staff must verify a child's age by obtaining an official certificate of birth, verification of birth from a hospital, affidavit of parentage, or other governmental form that lists the name of the parent and child. If presenting such documentation creates a barrier for the family to enroll the child, staff must consult their supervisor to assist in removing the barrier. A pregnant woman or child is eligible if the family's income is equal to or below the poverty line, the family falls into an automatically eligible category of receiving public assistance, self-identifies as homeless in alignment with McKinney-Vento, or the child is in foster care. Additionally, there is a 10% allowance to serve families who are over the income guidelines or who do not meet the eligibility requirements if there is a compelling reason to enroll the child. Most often, this is used for a child who has disabilities identified. To verify eligibility based on income, staff must use tax forms, pay stubs, or other proof of income to determine the family income for the 12 months preceding the month in which the application is submitted or the previous calendar year. If the family cannot provide allowable proof of income for the relevant time period, program staff must accept written statements from employers, including individuals who are self-employed. If the family reports no income or self-declares income for the relevant time period, a program may accept the family's signed declaration to that effect. If the family can demonstrate a significant change in income, program staff may consider current income circumstances after conversation with their supervisor. To verify whether a family is homeless, a child is in foster care, or a family qualifies due to receiving public assistance, a program may accept a formal written statement or any other official documentation showing the family meets these eligibility categories. If a family cannot provide one of the documents, staff may seek information from third parties who have first-hand knowledge about the family's living situation. If the family gives consent to contact third parties, program staff must adhere to program privacy policies and procedures and ensure proper documentation is completed. Family means all persons living in the same household who are supported by the child's parents or guardian's income, related to the child's parents or guardians by blood, marriage, or adoption, the child's authorized caregiver or legal responsible party. For EHS application only, the unborn child also counts as a member of the family. Staff must verify that the person applying has legal authority to apply. Family engagement specialists are tested on eligibility scenarios each year. Questions are changed based on unique situations that come up during the previous program year. If a child is determined eligible and is participating in Head Start, program eligibility status is good for 2 years. If a child moves from an early Head Start program to a Head Start program staff must verify the family's eligibility again. A program must keep eligibility determination records for those currently enrolled as long as they are enrolled, and for 7 years after they have either stopped receiving services or are no longer enrolled. Each application must include the following forms: eligibility verification, interview notes and calculations, allowable birth record, selection criteria, placement form for preschool, signed Child Plus application, and copies of any income documents or statements that are deemed necessary to verify eligibility. Staff annually review and sign a code of conduct which outlines consequences and actions taken against staff who are intentionally providing false information or who do not follow eligibility determination procedures. The recruitment process is designed to actively inform all families with eligible children within Jackson and Hillsdale counties of the availability of program services and encourage and assist them in applying for admission to the program. Specific efforts are focused to actively locate and recruit children with disabilities and other vulnerable children, including homeless children and children in foster care. Community Action Agency has strong joint recruitment partnerships with both intermediate school districts, which includes an online recruitment option for children ages 0 to 5. Selection criteria weighs the priority of selection of participants and is based on the following criteria: income or eligibility status, age, if the child is eligible for special education and related services or early intervention services as determined by the Individuals with Disabilities Education Act, other relevant family or child risk factors as determined by the Community Needs Assessment and in coordination with the risk factors for the Great Start Readiness Program. The program must ensure at least 10% of its total funded enrollment is filled with children eligible for services under IDEA. Strong collaborative partnerships with both ISDs and Early On help us meet this goal. As with community assessment, the selection criteria are reviewed annually as part of self-assessment to make needed adjustments to ensure the most vulnerable children are identified for services. Full funded enrollment must be obtained and maintained. Vacancies are filled as soon as possible and must be filled within 30 days. The program must make efforts to maintain enrollment of eligible children for the following year. Under exceptional circumstances, a program may maintain a child's enrollment in Head Start for a third year, provided that family income is verified again. A program may maintain a child's enrollment in early Head Start and must only re-verify income upon transition to Head Start. When serving homeless children or children in foster care, staff must make efforts to maintain the child's enrollment regardless whether the family or child moves to a different service area. The program complies with state licensing requirements for immunization, enrollment, and attendance. The Child Plus database is used to track attendance for each child and to identify trends in attendance across classrooms. If a child is unexpectedly absent and a parent has not contacted the program within 1 hour of program start time, staff must attempt to contact the parent to ensure the child's well-being. If monthly average daily attendance rates fall below 85%, data must be analyzed regarding the causes of absenteeism to identify any systemic issues that contribute to the program's absentee rate. Staff must use this data to make necessary changes in a timely manner as part of ongoing oversight. Head Start programs must prohibit expulsion and severely limit the use of suspension due to a child's behavior. Such suspensions may only be temporary as a last resort in circumstances where there is a serious safety threat that cannot be reduced or eliminated by the provision of reasonable modifications. Before staff determine whether a temporary suspension is necessary, consultation with the mental health consultant, collaboration with the parents, and utilization of appropriate community resources must occur with a formal plan written to help the child return to full participation in all program activities as quickly as possible while ensuring the child's safety. Families must never be charged a fee to participate in Head Start, early Head Start, including special events such as field trips.